So welcome everyone. Thank you for taking time out of your schedule to join us today. I know it is evening here on the East Coast, but it's quite early with our presenters over on the other side of the world. We appreciate everyone coming. This is our final presentation from our 2021-2022 grant webinar series. As you may have just heard, we are recording this session for future learning. We will hope to have this posted in the GRNEN website in our community by the end of the week. And as always, we encourage you to share this presentation with students, colleagues, peers, anyone that will enjoy listening to what we have to offer today. Before we begin, I just want to do a little bit of housekeeping. We are going to leave plenty of time for Q&A. But in order to get through our presentation, we will be holding that till the end of the discussion. You will be able to post a question in the Q&A feature or on your chat panel at any time, so you don't forget it, but just be advised that we will hold that towards the end and then ask that on your behalf. I'd also like to just give a quick mention to Corey Kilgore and the MHCH Foundation, who generously funds the Global Rural Nursing Virtual Collaboration Learning Grant. Unfortunately, Corey was unable to be with us this morning, but I did want to take a moment to recognize MHCH for all of the funding and the work that they do to provide this opportunity for our community. We are having a little bit of some technical issues. As you saw, Jean might have just dropped off, but I'm confident she will be back on. So let's go ahead and introduce our presenters today. Jean Ross, who is one of the co-founders of GRNEN, is a professor at nursing at the Otago Polytechnic in Dunedin, New Zealand. She has more than 25 years of experience working with the rural nursing workforce, including the areas of research and education. Jean's work with rural nurses began in 1994 with the establishment of the National Centre for Rural Health in New Zealand, which she was co-director. Jean has published 2 books and numerous journal publications. Kate Emmond is an academic from La Trobe Rural Health School, La Trobe University, and Bendigo, Australia. Kate specializes in mental health and therapeutic communication for postgraduate and undergraduate nursing and paramedicine degrees. Her research focuses mental health assessments and management in pre-hospital care. She has background in comprehensive general and mental health nursing. Kate's interests include therapeutic communication, clinical decision-making, clinical thinking, mental health triage, mental health presentations in emergency departments and pre-hospital care, crisis assessment and treatment, community mental health, service delivery, policy, e-health, and communications technology. She also has special interest in clinical education, blending learning, and simulation. Kate has previous experience in leadership as a senior psychiatric clinician in management and in senior project positions. Unfortunately, Kate's not going to be able to join us today as planned, as she is under the weather. We are grateful for her friend and colleague, Melanie Bish, who will be joining us today on her behalf. And the other presenter that we are having today would be Keith Whidden. He is a local authority inspector and advisor and passionate advocate on how new technologies transform learning and teaching. Having taken early retirement, Keith moved to Shropshire 6 years ago and is now a full-time musician. He chairs the Bishop's Chat Castle Community Partnership and is a college governor. And unfortunately, due to time zone challenges, Keith is unable to join us. As you can imagine, trying to coordinate timeframes that work for the East Coast, for New Zealand, Australia, and the UK are a little bit difficult. But Keith and Kate were both incremental in this presentation and the project that went forth to put it together. Melanie, I'm sorry, I don't have the bio on you since this was a late edition, but I would welcome you to say hello and introduce yourself to the group.
Well, thank you very much. And look, like all good nurses, we all jump in and cover each other when things are happening. So that's what's happened today. But hi, everyone. It's my pleasure to be here representing La Trobe University. My name's Melanie Bish, and I'm an associate professor in rural nursing and midwifery at La Trobe University, and I'm also based at the Bendigo campus of La Trobe Rural Health School. So work closely with Kate and have worked closely with Jean and Keith throughout this project. So my role in the university is the Deputy Dean of the La Trobe Rural Health School. So I'm very involved in globalisation and particularly making connections with other universities and community groups that are supporting rural nursing and midwifery, hence the collaboration that we've been able to foster through this particular piece of work and the grant that supported it. So my interest is very much around professional issues in nursing. So my research activity tends to extend into leadership and also issues such as recruitment and retention of the nursing workforce and clinical and corporate governance, as well as organisational culture. So whilst I've sort of got a general background in nursing, my really support and involvement in this piece of work was supporting the connection and the globalisation element and the opportunity for our undergraduate students to connect with colleagues and develop that global nursing community of practice in our undergraduate program has been a real priority for both universities. So again, thanks for the opportunity to come and share with you today.
Well, we're grateful for having you, and thank you for stepping in on Kate's behalf.
Okay. Well, I can actually start us off if you like, and I'll work the presentation, knowing that Jean and I are representing both universities as well as the community of Bishop's Castle today. So again, thank you for your patience while we've got ourselves organised, and today we're actually focused on presenting the piece of work that has been done recently, focusing on interactive virtual reality, engaging a rural community to enhance local and global knowledge, but of equal importance, the collaboration that can happen. And the emphasis on today's presentation will be how we've achieved this through using the CHASE model. So Jean will be able to offer detailed information about that. So normally when we start a formal presentation, I would like to, as a fifth generation Australian, just acknowledge the people of Jara country who are the traditional owners of the land on which I'm sitting today, and pay my respects to elders past, present and also emerging leaders, and also acknowledge the traditional owners of wherever you all are, and share the commitment that we as nurses, as a profession, have to the health and wellbeing of all Indigenous and First Nations people across the globe. And you'll see that that thinking has come through in the way that this collaboration has also unfolded. So in addition to that acknowledgement of country, I'd also like to thank the Global Rural Nursing Virtual Collaborative Learning Grant organisation team. We're very appreciative of the resources that have come through to enable this collaboration, and in terms of the quality of the resources that we were able to create, but also the learning that afforded the students by being able to have those resources was particularly valuable. So by way of extension, also to thank GRNEN in terms of the commitment to supporting inter university in this case and community collaborations and the governance that GRNEN have provided over this period of time. With Stacey's introduction, you would have understood the importance that Bishop's Castle community have played in this piece of work, and we would also like to acknowledge John Kelly, who did the actual film making with the resources. We would also like to acknowledge Jean's colleagues at Otago Polytechnic School of Nursing, being the third year Bachelor of Nursing students who participated in the program, and as well as Professor Samuel Mann. And from La Trobe, of course, our students as well here. And I'm on there as an acknowledgement because I was involved, but let's acknowledge Kate, given she's not here today. So, and Kate was the person who collaborated directly and worked with the students over this piece of work. So I'll hand over to Jean now just to talk about the relationships and collaboration.
Thank you, Mel. This is us introducing ourselves. So from the perspective of the learning grant, it was a three-way and including GRNEN. So in the end, it was a four-way process, but it was on the globe there, you will see Australia and you will see in yellow New Zealand. And for anybody who thinks that New Zealand is connected to Australia, we're not. We are a 3-hour flight away. And as you can see on that globe, it represents Australia is significantly bigger than New Zealand. And then on the other side of the slide here, we have the community of Bishop's Castle. And you may wonder what they're doing there, but actually this is a 2-year project in which they wanted to have significant finances and human finances, or social capital as well, in order to develop and run a community hub in the rural medieval village of Bishop's Castle. And this is the day that they had the key handed to them, that this was the old newsagent shop, and the council, the local council, had said, yes, okay, here you go. And our students from New Zealand have been working over a 3-year period with Bishop's Castle community stakeholders to look at identify the health needs and identify how those could be improved to reduce health disparity. And so this is the two front people here is Keith Whidden. He's the guy, and Hope Robson, who is a very young, vibrant young lady who was born in Bishop's Castle and is now a social prescriber for the community. Thank you.
So as you can see, there's a significant commitment that's been made through this piece of work that's detailed by the amount of aims and objectives. So whilst I know this is a text-heavy slide to show you all of those, we're really committed to demonstrating the breadth and depth of what this piece of work was aiming to achieve. As you look through the aims, you'll see that there is a real emphasis on mental health. So, and appreciating where we are at the moment in terms of the globe and coming out of the pandemic, it's not surprising that mental health was something that's high on everyone's agenda and an area that is worth actually paying some attention to. So in terms of having aims, they're very much around individual aims for people, but also lifting that up to having community aims as well. So things like combating loneliness and social isolation at a community level. So we actually intended to develop an interactive virtual reality film of the rural village of Bishop's Castle to enhance our nursing students across both universities' engagement and understanding of the community as they profiled and assessed this community's health and identified the health needs. So we intended to showcase the CHASE model in action and have this supported with the virtual reality film of the rural community and doing this with all nursing students. So we were aiming to encourage the students to share their knowledge from their own countries and including the community case study in the UK in relation to the rural community development and public health. And as I said, there's a really strong focus on mental health of particularly the rural youth and COVID-19 lockdowns. So in terms of being able to evaluate the project and the value of including virtual reality, making sure that everyone's clear on the aims and objectives of the project is a priority. So hence why we've got those up there for you. The CHASE model with all students and the stakeholders of the case study saw us have the intention of the third-year nursing students from both Australia and New Zealand interact with the GRNEN approved virtual networking and collaboration tools that were created. And by using these particular platforms and engagement opportunities, they were able to, right from the commencement of the program, connect with each other and share in different ways and at different points of time through the program and also drawing the program to completion. So we're very keen to explore the possibilities of linking similar interactive virtual reality films of rural communities together in the future and even aspire to grow a regional and national and global network through GRNEN of rural communities, and making sure that that extended to student nurses and their learnings and how they've engaged with the CHASE model. So we see that this way of working would promote international collaboration and unique learning opportunities, and also enable students to have global connections and foster relationships with other students, but also then connect with the community case study. So this would also lend itself to being able to research the way that students are connecting, and groups of nursing students and nurse educators relative to the healthcare discussions from their respective countries, because it's been quite interesting in terms of what's been revealed. We share a community of academics at the moment situated in Australia and New Zealand, as well as the United Kingdom, who've been involved in this project and are positioned to examine the process and outcomes and evaluations of the initiative. And it'll be great for us to be able to share and disseminate those results locally within our own communities, but globally. And that's the beauty of this webinar as well, is making sure that we can share that today. So I'll hand over to Jean again to progress with context, place and people.
Thank you. So as Mel has said, this was a situation that we were connected with the rural medieval village of Bishop's Castle, with community stakeholders and ourselves in New Zealand, and Mel and colleagues Kate and the students in Australia. We need to learn from context. We need to learn about the place. We need to learn about the demography and the topography and the history of place, and how people have lived there previously, currently, and what their aspirations are for the future. So the rural population accounts for almost half of the total global population, and people in rural areas often suffer more than their suburban or metropolitan counterparts due to a lack of access to healthcare, which is in turn related to the lack of providers, including specialists, travel issues and/or cost. Those living in rural areas are more likely to develop and succumb to a number of chronic and acute health issues, and are more likely to die of unintentional injury. Infant mortality is higher among rural children, and life expectancy for men and women in isolated regions are less than those in urban areas. And isolated populations often develop collective customs and habits that directly affect their health, and this includes Indigenous populations. For instance, Alaskan Natives, Americans, Australian Indigenous, New Zealand Indigenous are more likely to seek routine and emergency medical care than white people. Sorry, they are more likely less to than white people. This adversely affects their health. Alcohol, drugs and smoking is also prevalent, and in New Zealand the population are also associated with socioeconomic deprivation and poor health outcomes, including the incidence of mortality, hospitalisation, health risk factors, chronic disease and many acute conditions. Life expectancy is similar for both rural and urban in New Zealand. However, there is a difference in the life expectancy of Maori to non-Maori Indigenous population. Sorry, I'm just looking at my notes page. These practices may lead to chronic health conditions and more health issues. Even in countries where the majority of the population live in rural areas, resources are concentrated in the cities. All countries have difficulties with transport and communication, and all face in a position the position of challenges of shortages of doctors and other health professionals in rural and remote areas. Nurses, for instance, make up the largest segment of the global healthcare profession and are in a position to play a critical role in reducing rural health disparities. Rural nurses need broad-based knowledge, a cradle-to-grave perspective on health, and to be committed to learning to work and collaborate in new models of healthcare. They must be capable and competent of working with the rural community residents to gather and analyse population level data, promote wellness and disease prevention, assist in adopting and disseminating best practice for population health, and identify patients who are greater risk of disparity, necessitating greater outreach efforts. Therefore, we are promoting that place is important because it is central to the social world, and place occurs when meaning, naming, or the feeling of connection occurs with that location. When space and place work together, they are more dynamic than working separately, and therefore the weaving of space and place and nursing's engagement with place are and will be revealed within this presentation. Thank you, Mel. Therefore, in our contribution to this grant, we looked at how can we understand best practice, and therefore we have engaged with what is the CIPP evaluation model, which relates to context, input, process, and product, as you can see from this image here, of which I will share with you, as Mel will, in a couple of slides down, how we have evaluated these 4 aspects of this project. Thank you, Mel. But firstly, I'd like to introduce you to the CHASE model, a model that was developed in 2017 to assist student nurses from New Zealand to undertake community profiling, assessment, action, and develop health promotion messages and resources to improve the health of rural communities. CHASE stands for Community Health Assessment Sustainable Education Model, and we called it In Action. And this was our plan to be able to work alongside and with the community of Bishop's Castle. I'm not going to go through the whole of this, but you will see that it has a pre-engagement phase, which we believe is extremely important, where the facilitator or the lecturer, that is somebody like myself or Kate in instance in Australia, engage in the community prior to any idea of even engaging students in that community. So it is a pre-engagement. It is a time for talking with community stakeholders, seeing what their attributes are, seeing if they wish to have a community profile assessment undertaken on their behalf or with them collaboratively. And we found that over the years, this is an essential aspect to be able to work collaboratively with that community. And as I mentioned previously, we have for 3 years worked with Bishop's Castle, and the last part of the project this year was to provide a 3 to 5 year strategic plan for them and go back in 3 to 5 years to see what has eventuated. It also has a pre-orientation phase where we set up the planning of the development with the community, and for us in this project that was between the chairperson of the community in Bishop's Castle, between Kate and Mel in Australia and their students, and myself in New Zealand. That was the planning phase. And then the orientation is an orientation for the students to orientate themselves to what is expected of them. Then we move into the phases, which is phase 1 to 9, which has been adapted over the years to include more phases as we have learnt and evaluated what we have done. So this is a really good model to firstly profile a community, assess a community, take into consideration cultural and ethical aspects of working with that community, to then undertake a health needs assessment, looking for and working with the stakeholders of that community. And when an identified population has been identified and their health need, it is discussed and in partnership with that community agreed upon. And then the students undertake a evidence-based literature review on the topic and on the with the identified population, as well as taking into context the issues such as place and people. So in this instance, it is rural, and they go to the local, national, and international literature to assist them in that. And that then comes working with the Ottawa Charter, a public health approach, the development of health promotion message, which then is transferred into a health promotion resource that is appropriate for that community, and it is then presented back to the community. We then undertake over 3 to 6 month periods at the completion of phase 5. We then look at the impact that this has had with the community and align that up with the sustainable goals, 17 sustainable goals. We have got, there's COVID. COVID changed the approach that we were taking from 2020 to a virtual approach. And that means that we can work virtually with the community, as we have done from New Zealand to Bishop's Castle. And that led us to think, and that is what this project has all been about, is how can a student get to understand the context, place and people from a virtual perspective. And so therefore, the next slide, please, Mel. So therefore, we had the idea of ensuring that the students could stand in the shoes of the community. And we produced this film. If you'd like to click on that, and we'll just show you the first 30 to 40 minutes, Mel, please. Now, this is a film that's been produced by a filmmaker for the students from Australia and New Zealand to get to know the Bishop's Castle context, people and place.
Can I just check everyone can see that?
Yes, we can see it, but not hear it. So I'll just take you through this as we can't hear anything. That what the filmmaker's doing is
Jean, you're frozen. I'm not sure if you can hear me.
this medieval village, and then utilizes the foot survey template in looking at the different aspects of how the students are going to profile and assess this community. So as you can see here, there are very narrow roads. So we're using the foot survey template, as I said, about housing, roading, safety, transportation, education, recreation, and it also then engages with Anderson McFarlane's Communities Partner Wheel. And so there is a process behind this of which the filmmaker has been able to write the storyline in which to then engage in producing a film. What we found was that the students who watched this, both from Australia and New Zealand, actually could start to really understand the complexity of this medieval village. And as you can see with our trained eye as a registered nurse, you could see that there was a there was a snow scene, there was a spring scene, there was a summer scene, and from that you can actually then, as nurses, we actually can assess that community. We start to think about the complexity. Is there an ambulance service here? Is there a hospital service here? How do people get from one place to the other? And actually that's what makes it very interesting. And what we found is that the students could ask more significantly in-depth questions to the community stakeholders via Zoom meetings and emails, to gather and be able to develop up a much better comprehensive profile assessment of the community and ask those significant questions. It runs for about 20 minutes, so I think we might stop there, and there might be some questions about that at the end. So what I'd like to now is to take us back to the CIPP evaluation model and look at the first aspect of it, which is about goals. And we've actually looked at this in relation to the GRNEN grant and looked at it from an evaluation perspective. So this looks at, firstly, the beneficiaries, and the beneficiaries were the rural community of Bishop's Castle and the nurse learners, as well as the two institutions. And we think that the beneficiaries received appropriate and advanced education because of this grant. The needs that were identified were, from the Bishop's Castle community, were mental health needs, and those were related both to youth and to older adults. And that had really been, the older adults were related to social isolation, for being in lockdown for 18 months in the UK, and also a higher rate of dementia amongst older people in the community. And for the youth was high suicide rate. And what was very interesting in this isolated community is that from the age of 16, there is no education in this community, and those young people need to transfer to other high schools out of their district, where there is very bad transport, where there is a lack of jobs for these young people, and all that has an implication to their mental health. The resources we developed, we've just shared with you, which was the CHASE model and the documentary film that we produced. And we do believe that both these resources have benefit to this project. Problems was, yes, distance, and we tried to counteract that with the models that we developed, but also working amongst time zones. And as you will see today, Keith Whidden, the chairperson of Bishop's Castle community, was unable to join with us as it is a time zone that it did not work for him. We're looking at background, and this is very much collaboration established between all parties with common goals to improve the health of rural populations. And the environment was global rural contexts, as I've mentioned, and Indigenous populations. Thank you, Mel. And I will talk to the next slide because Keith isn't with us. So again, now we've moved on to the next part of the CIP model, which is plans. And this is Bishop's Castle's evaluation. So stakeholders, Bishop's Castle community, nurse learners and GRNEN, as mentioned previously. Strategies to enhance community assessment at a distance. Budget established with the grant from GRNEN, but there was challenges between the four countries and getting the money transferred, and also with payments. Coverage, the use of technology is something that we have promoted, and the research aspects is the evaluation and the data analysis, which we will share in a published paper. Thank you, Mel.
So from La Trobe University's perspective, and again being informed by this evaluation. Oh, being informed by the evaluation model. At La Trobe, our approach to this was very cyclic, and you'll see there it really aligns with a quality assurance approach as well, because we embedded this program into curriculum. So history shows that when learning opportunities are part of an undergraduate curriculum, the engagement of students is higher. So it was really important for us to be able to create an alternate assessment for nursing students and gain approval from La Trobe's academic board to support this. So achieving that was actually a significant milestone, because we weren't adding to students' work. This was part of their learning embedded in a third year mental health subject. So in terms of the implementation, the information about the rural community via video was really important. And the communication channel that was established between students and facilitators with time differences, there were challenges there, but it was certainly not something that we couldn't negate or overcome. And that was part of the students' learning as well, in terms of when you're collaborating with colleagues overseas, how do you actually create that sense of team? And that's where the structure that's provided in this piece of work really gave the students a great sense of shared understanding of the point of collaboration and their role and what they were going to contribute. In terms of monitoring, Kate actually was very in touch and communicating regularly with students' progress, and also making sure that there was a strong alignment in their thinking and their progress of their piece of work with community needs. So making sure that it was continually coming back to the information that they'd received about Bishop's Castle and the challenges, and then lifting that up to think about the global context as well and what was going on in this community. Feedback from the students was that they really enjoyed the experience. Time zones, okay, that was a bit challenging, and we needed to think about our time frame, appreciating that they're all enrolled in other subjects as well. So really making sure that we were providing resources in a timely manner, and the expectations of participation were realistic. And the other thing too is it was really interesting for students at this point in time to think about collaboration using these platforms, because the expectations of the students with working online via different online mediums was actually quite low, because they've got so used to it over COVID. They're used to using technologies. They're used to working with other colleagues, even within their cohort, via Zoom and via different platforms. So in terms of where they were sitting with expectations, they were really quite open to this way of learning. Jean, I'll hand over to you for Otago Polytechnic.
Thank you. So as you will see, as we continue with the last aspect of the CIPP evaluation model, Otago Polytechnic has focused on the outcomes. So this is impact, which was to improve the population health. And we have certainly been able to demonstrate that through facilitation and guidance by the lecturers, that was Kate and myself. So it is time consuming, as Mel has just mentioned. Effectiveness, by ensuring we were regularly staying connected with our community stakeholders, had a significant positive impact on the project. Through live Teams meetings and email and Zoom, we were able to update the community and liaise with them around our chosen health issues and the health promotion messages. And in partnership with this community, we were able to focus on producing a product which would be beneficial for the Bishop's Castle community and youth, which we identified as the health outcomes that needed addressing. From the point of view of working alongside with La Trobe, as mentioned here under transportability, La Trobe students really went and did a significant and a wonderful focus of mental health and youth within their own community to actually share with the students of New Zealand. And they focused on the rainbow community. They really looked at mental health, and their resource was significant, and Kate was very, very impressed with them, and it may even have some implications for the campus at some stage. And Mel, you might want to talk to that. So at OP, the group presented their findings on Bishop's Castle by using nursing frameworks. They incorporated the framework of Te Whare Tapawhā, which is the New Zealand Indigenous population framework, into their presentation by using a holistic approach to discuss all 4 aspects of the health needs: physical, mental, social, and spiritual. They also used the framework of the Community Assessment Wheel and by Anderson McFarlane. This allowed them to develop a comprehensive display of all relevant health issues, disparities within the community. Together with these frameworks, enabled them to give La Trobe students an extensive insight into the health needs of Bishop's Castle, which they picked up on, and it became evident that they successfully communicated this information after La Trobe produced a presentation to the students of New Zealand in return, which contained and expanded all that they had developed. Sustainability, ongoing relationships and model development, partnership, collaboration, and communication are very much important to maintain sustainability between the 3 groups, and of course with GRNEN. So sustainability included meeting with the stakeholders, where we could discuss with the 2 general practitioners there and 1 district nurse. And from our conversations, our group were able to reflect upon the position Bishop's Castle is in with the closure through COVID of their community hospital, and how it had affected health outcomes for those with more serious conditions and medical events that required very prompt medical response. Through this, we discovered that there were 5 district nurses that covered 10 rural communities in the Shropshire region. And therefore, there was an empathy towards those district nurses and how they were expected to work with the closure of that hospital and with the increase in social isolation of older people and the mental health of youth. And the last one is adjustment. We had initially sought to develop a virtual film, but from discussions with the filmmaker and from the stakeholders, it was not going to be effective to have a virtual one with high technology requirements where you would pop your cell phone into a mask, or a mask, and you would walk through Bishop's Castle yourself. We realized that that was high technology and maybe did not have the beneficial effects of a documentary that can be used, can be put in a library, and can be engaged with lots of other different people. So we moved from virtual to a documentary. So the adjustment advice from the Bishop's Castle community and filmmaker indicated a virtual film was not going to be beneficial for a global audience, so we opted for a documentary. Thank you. Mel, I'll read to the next slide. So where to from now? Future directions are that we continue with the Chase model. We share it internationally. We know that Australia is interested, USA is interested, and Scotland's interested. And from that, we want to encourage and engage student nurses to feel comfortable by engaging in community development from a public health perspective and improve healthcare of communities and rural people. What we have done is we have engaged with the IACD, which is the International Association of Community Development, and they have indicated that our students, because they meet the capabilities of being a community development practitioner, are able to receive a micro-credential from the organisation and are able to, at graduation, call themselves a community development practitioner. As I said, we'll collaborate with the Chase model and adapt and advance it. We want to work more with design and see how these nurses are co-designing and nursing as a designer. That's a piece of work that's ongoing at the moment. And we will continue to undertake collaborative evaluations of our work. And we have an ongoing focus of working alongside with GRNEN and to open up an international centre for global community development. At the present minute, we are writing a book with Springer Publishers on the development of Chase, and including a number of case studies from around the world, including the UK and Vanuatu and New Zealand. So we'd like to say, if you'd like the next slide, Mel, to say thank you very much and thank you for your patience, and that we are open for questions. Thank you.
Thank you for the presentation. That was incredible. I know we are approaching the top of the hour. So what I would like to do is to welcome any questions that you may have into the chat or the Q&A feature of your Zoom panel. I would also like to remind you that this will be posted to our community, and at any point you may feel free to go into that section and ask a question of Jean, Mel, Kate, or any of the other individuals. They're active members of our community. So if we do run short on time here today, those questions can be fielded directly through our website. So if anyone has any questions, we'll go ahead and take those now. Now, Jean, I know that when you shared your presentation, there was a link that accessed the video that you produced. Once we share that on our website, will people be able to watch the video in its entirety from that slide?
Yes.
Wonderful.
Yep.
Wonderful. I think that will be an important piece of this, to be able to see the whole thing. And I know that sometimes when you share videos in Zooms, there's audio challenges. So to be able to watch that entire video with the full, it will be.
And Stacey, there might have been with that because there was a music with it. So there's no talking with it, and that's why I talked over it, just to give people a sense of it. But it does take people through the whole community of what the students also were engaged with.
Okay, perfect. So we will make sure that that is posted to the website with that link. And we encourage everyone to go and watch the full 20 minutes. It will definitely be worth your time. So if there aren't any questions at the moment, again, feel free to jump into the community. We will post the recording of this presentation hopefully by the end of the week. We will have a few other webinars coming up towards the end of the year. As of now, we are in the process of putting together a webinar looking towards November timeframe on Indigenous populations and the healthcare challenges and similarities that are present within those rural communities. We want to thank you once again for taking the time out of your schedule to join us. Thank you, Melanie. Thank you, Jean, and also Keith and Kate, who couldn't be with us today. And we hope that you all enjoy the rest of your day or evening, wherever you might be located. So thank you, everyone. Take care.